So let's transition to falls in the elderly. Why is this relevant? It's relevant, again, because we practice evidence-based medicine, and our assessment and intervention should translate into an improvement in quality of life and life expectancy. This is relevant because falls are common and they correlate with age. In individuals above the age of 65 years, as much as 60% report falling in the past month, and as much as 33% report falling in the past year. In individuals above the age of 80 years old, more than 50% of them report falling each year. If the individual has a history, if the older adult has a history of falling in the previous year, the annual incident approaches 60%. Why is this relevant? It's relevant because every 17 seconds, an older adult is treated in the emergency room for complications associated or related to a fall. Why is this relevant? It's relevant because every 30 minutes, an older adult will die from injuries sustained in a fall. This is also relevant because there's a tremendous economic or healthcare burden that's associated with falls. The direct cost is attributed to ER visits, emergency room visits, hospitalizations, outpatient visits, physical therapy, medications, and the cost associated with assistive devices. Indirect costs are related to disability, work loss, compensation, mental or emotional anguish, property damage, litigation, and law enforcement. So what is a fall? What is a fall? These are examples or images of a fall. But what is a fall? What's the definition of a fall? A fall is a sudden, uncontrolled, unintentional loss of balance that leads to failure of postural stability. It's also a drop or descent of the body under force of gravity to the ground or floor or other lower level. What are some of the consequences of a fall? Falls impact quality of life and life expectancy. Therefore, falls can threaten independence and lead to disability. Complications of falls are the leading cause of death from injury in individuals above the age of 65 years old. So falls are not the leading cause of death in individuals above the age of 65 years old. The leading cause of death remains heart disease, strokes, and malignancy. But complications from falls are the leading cause of death from injury in individuals above the age of 65 years old. Most falls result in minor soft tissue injury. Some additional consequences of falls: approximately 1 in 3 or a third of those who fall need medical attention or need to restrict physical activity. As much as 15% of falls, 15% result in fractures, and 5% of falls result in serious soft tissue injury or head trauma. Among those who do not experience physical injury, falls are associated with a decline in functional status, a greater likelihood of nursing home placement, increased use of medical services, and again, development of fear of falling, which can lead to social isolation and depression. So let's brainstorm. Why do older adults fall? If an older adult has a history of a fall, then the risk of a recurrent fall is greater. Medications may also lead to falls. Osteoarthritis, degenerative arthritis, gait and balance abnormalities, mobility abnormalities can increase the risk of falling. Deficits related to Parkinson's and strokes and/or other neurologic problems can lead to falls. Postural hypotension can lead to falls. And fall risk is also increased with age-related changes, such as changes in the individual system or changes in the proprioceptive system or changes in the vestibular system. Those changes may lead to an increase in the risk of falls. And finally, environmental hazards may lead to falls. How do we prevent and how do we treat falls in older adults? A multidisciplinary team-based approach is recommended. A team-based approach that incorporates not only the PCP, not only the primary care physician, but also includes or incorporates other specialists, including the physical therapist, the social worker, the family, the psychiatrist, the ophthalmologist, and the pharmacist. It is also recommended to use a multi-component evidence-based approach that takes into account addressing identified risk, eliminating identified hazards, treating underlying medical problems, and removing environmental hazards. Therapeutic lifestyle modification is also important. So dieting is important, exercising is relevant, and weight management is relevant. Offer an exercise program to incorporate balance, gait, and strength training. In terms of specific Intervention measures. Medical management may include treating underlying causes. In the setting of visual impairment, address vision issues. For example, in the setting of cataracts, cataract surgery may be indicated. Manage postural hypotension, manage heart rate and rhythm abnormalities, minimize the use of medications, interval review or medication reconciliation is indicated. Taper or eliminate non-essential medications, including psychoactive medications. Supplement vitamin D. There's evidence to suggest that vitamin D supplementation in the scale of 700 international units to 1,000 international units is associated with a 9.5% absolute risk reduction in falls. Consider injections and heating modalities. Manage footwear and foot problems. Modify the home environment and eliminate environmental hazards. In terms of exercise, initiate an individually tailored exercise program. Incorporate more than one exercise regimen. Exercise as defined as repetitive, focused, task-specific activity. Improve strength. That's geared towards improving strength, improving flexibility, improving endurance, improving balance, and improving gait. There may be a role for supervised exercise or physical therapy, which is structured, repetitive, and focused. There may also be a role for electrical stimulation and or heat therapy. Assistive devices, depending on the situation, may be indicated, and surgery, depending on the underlying situation, may be indicated. Thank you.